Well, hello. Okay. No one wants rabies. I feel like we've established that, and we've all seen Old Yeller. It's terrible. No one wants rabies. This is what those Nagrai bodies look like. It's usually done post-mortem after the animal has already died to make sure that they in fact had rabies. So get a rabies shot for your animals. Arboreovirus and encephalitis. So basically we're talking about encephalitis, and it comes from blood-sucking arthropods, aka mosquitoes, which are disgusting and I hate them. Mosquito-borne arboreoviruses can cause arboreoviral encephalitis. Of course, a good time. Usually cause mild cold-like symptoms, can cause encephalitis if they cross the blood-brain barrier, and they typically infect animals. There are 6 arboreoviruses that are caused most in the United States, and West Nile virus is one of those. Here are some examples. Yay! You can find those in your book if you just want to know more about encephalitis. Okay, here's also humans can be affected by mosquito bites with encephalitis, and then you have other kinds of things like mosquito eggs, chickens, birds, rats, horses can all get encephalitis. Birds and rodents are the normal host for encephalitis. People who engage in outdoor activities in endemic areas are at risk for infection, and older adults and children are more likely to have it. And of course, it's seasonal when mosquitoes are around. So here are some of the reported West Nile viruses that have happened in the United States, and it typically is cyclical based on when mosquitoes are most prevalent and outside. Confirmed by presence of antibodies in the cerebral spinal fluid. Treatment is supportive. Prevention involves limited contact with mosquitoes. Use nets. Eliminate stagnant water. And there are vaccines for horses available. The Zika virus. This is congenial and also a virus. Often asymptomatic, it infects pregnant women and can cause congenital Zika syndrome. Infants may be born with brain abnormalities and microcephaly, may also disrupt normal development of the heart, digestive system, or genitalia. The Zika virus is the caustic agent, and it's been that we've basically done the whole genome of it so that we know what it is and who it's related to. And here is where you typically find it. And this poor baby has the Zika virus. It's transmitted via mosquito bites. So again, let's eradicate mosquitoes and the world will actually be a happier place. Mosquito bites or sexual activity. It preferentially replicates in brain cells. It was discovered in Africa in the 1940s. We can detect the viral RNA or antigens in the patient's sample. There's actually no standard treatment, and prevention relies on avoiding mosquitoes, proper mosquito control, and safe sex. Why? No, we're going to skip that one. Mycosis are fungal diseases spread from the lungs to the central nervous system via the blood. Mushroom toxins produce hallucinations and neurological problems. May also produce fungal meningitis, our third flavor of meningitis. There's viral, there's bacterial, there's fungal. 3 ways to get meningitis. Fungal meningitis, signs and symptoms are similar to bacterial meningitis. Loss of vision and coma can occur in later stages. Cryptococcus neoformans is the caustic agent, and there's 2 variants of this yeast found worldwide. It resists phagocytosis by your defensive cells. Infection follows inhalation of spores or the dried yeast cells. Many cases occur in terminal AIDS HIV patients. It's diagnosed by detection of the fungal antigen, and hospitals try to prevent it in contaminated air. So it's actively monitored in recirculated air in hospitals. Why is penicillin ineffective in treating cryptococcal meningitis? Come on, you know the answer to this. Why can't we treat fungal diseases with penicillin? Because it's a yeast. Penicillin is antibacterial. We know this. Protozoan infections of the nervous system are African sleeping sickness and I can't even. Okay, I've been talking too much on these videos. African sleeping sickness, 3 clinical stages. Site of the bite becomes a lesion. The parasite in the blood creates fever, lymph node swelling, and headache. The protozoa invade the central nervous system, causing meningoencephalitis. It's characterized by cyclic waves of parasomnia. And it's caused by Trypanosomia brucei. It invades the immune system by changing your surface of your glycoproteins. So you get the little fly here, and then it infects your entire body until you are very, very sick. Okay. African trypanosomosis. I'm pretty sure that's how you say that. Diagnosed by a microscopic observation of your blood, lymph, spinal fluid, or tissue biopsy. You must begin treatment soon after the disease is known, and insecticide applications can help reduce occurrences, especially the tiny little fly that carries it. Primary amoebic, I can't even with that one. Some of these meningitis and encephalitis are caused by other microbes. Naegleria, entry through the host, diagnosis and treatment, detect the amoeba. Why has the number of cases of these things increased in society as it become more developed? Because the caustic agents are found in artificial water systems such as swimming pools and air conditioners. Okay, I also want to point out contact lens solution and dialysis, but mostly contact lens solution, and sometimes in humidifiers. This is where you can get encephalitis because your contact solution isn't, you've not changed the contact solution in your contact case for like a month. You should probably change it. Okay, prion disease is mad cow disease, leaves the brains of victims full of holes. You might guess that a brain full of holes is not good. There's some ideas that it may cause other forms of neurological diseases. Jacob's disease, again, insomnia, weight loss, memory failure, progressively worsened. We're not going to talk about Jacob's disease. Again, nope, we're skipping that. Microbial diseases of the eye. Let's just do one of these because we only have 3 minutes. The senses are an important part of the nervous system. Peripheral, right? Your eye usually intakes the oh, there's a bear, there's a spider, right? Vision comprises almost half the function of the cerebrum. So there's your eye, the cornea, all the retina, all the good stuff. Trachomia, leading cause of non-traumatic blindness, scarring of the cornea. Chlamydia, so you can get actually chlamydia of the eye, just in case you were wondering. Yeah, you can. Discharge causes deformed eyelids. Scarring can lead to blindness and typically, sadly, affects children. That is what it looks like. Sorry, that's the only gross picture of the day. So, also, trachoma, diagnosed, treatment, and prevention. Diagnosed by identifying the bacteria at the site of the infection, treating with antimicrobials, and sometimes surgery can correct the eye deformities. Other microbial diseases of the eye, bacterial infections of the skin, so that's styes, which we actually talked about in the earlier chapter, infections of the sebaceous gland near the eye. Ophthalmia neonatorium, it's an inflammation of basically right by the cornea of newborns. Mostly this is like infections of just parts of the eye. So that is infections of the eye, and we are done. Yay!